It's flu and cold season and the time of year when COVID also seems to spike, and now some emergency rooms are filling up. Action News Now reporter Tori Apodaca is live near Enloe Medical Center. So Tori, when it comes to respiratory illness, what are you learning today about when we should go to the ER and when we should just stay in bed?
Yeah, it's hard to say, Alan, but medical professionals tell me that you really need to listen to your body and know your own body. But of course, if you are concerned, it's best to go in. Both Mercy Medical Center and Enloe are seeing a surge of RSV cases. Director of Respiratory Care at Mercy, Heather Van Horn, says their most common patients have been children 3 and younger. Van Horn urges parents to watch out for some specific symptoms in their children.
First off, you can always see your primary care physician, but if they're not eating well, you're not seeing wet diapers, bring them to the ER. We're happy to evaluate them.
We learned from our earlier COVID surges that we can take care of lots of patients with respiratory viruses very safely, and we have close contacts with other hospitals if patients were to need to be transferred to a higher level of care.
My son was really young. It wasn't this guy, but it was one of my other boys. And yeah, we were in the hospital for a while, and he had a lot of breathing treatments, and it's definitely a scary time.
Mercy Medical is increasing staffing, monitoring use of hospital beds, using the emergency department and ventilators to meet the surge of RSV cases. It had 145 children test positive in September and October. And it's not just these children who are catching RSV. Van Horn says that both the elderly and immunocompromised are also at high risk. She says that as we're entering the holidays, if you're not feeling well, to stay home. Reporting live in Chico, Tori Apodaca, Action News Now, coverage you can count on.
Thanks for that information, Tori. Now, Van Horn says it's not uncommon to see an increase of RSV in the fall, but it is uncommon to see this many cases all at once.